to make sure.
Hello and welcome into this week's edition of AFMC TV. We're so glad you joined us. We've got a big show planned ahead. We hope you enjoy. JJ Mayo joins us with JM Wellness. And JJ, we are talking about important health numbers that we need to know. And today we're talking about A1C. What does A1C stand for, first of all?
Yeah, there's a bunch of different names for that. Thanks for having me, Michelle. Yeah, so hemoglobin, sometimes it's called hemoglobin H1C, A1C. You have HbA1c. You call it the A1C test. But basically, this test is a blood test, and it's the best test for diabetes. And the reason it's the best test for diabetes is that it really gives you a look at the average blood sugar that you have over 2 to 3 months. Whereas like when you go to the doctor or whatever, they do a finger stick to measure your glucose.
Yep.
That's just a measurement in one point in time. And really this A1C test is going to be the best test because it really measures what your sugar, your average blood sugar is running over 2 to 3 months. And if you want to get into the weeds on a little bit, it's basically the percentage of hemoglobin that's coated with sugar, right? Because hemoglobin is a molecule that carries our oxygen. It's found on the red blood cell. And when you have excess sugar in your blood, it coats the hemoglobin and they can measure that. So it's a more complex test, but it really is the best test to determine diabetes.
So I would expect that then this test would also be a fasting test and maybe one that comes from your vein, not your finger.
Yes, it could be. They now have devices that you can measure it from a finger stick, but most of the time when you go to your doctor, they'll do it through a blood draw. But here's what I will tell you, not a lot, and this is what your folks need to know, is a lot of people, doctors still don't measure an A1C test. And I've come across folks that they do just a blood sugar, just a single test of their glucose, and it comes back normal. But when you look at their A1C is high. So just know if your doctor's not measuring, because sometimes they'll measure it and they'll just say, we didn't measure an A1C on you because your glucose was fine. That doesn't always mean that, you should really have the A1C test done for sure.
And how often should you have an A1C?
Yeah, usually it's every year, but if you've had trouble in the past, then you could probably go every 3 months, 6 months to monitor your progress, especially if you have diabetes.
So what's the magic number? What are you hoping comes back?
Yes, and so because hemoglobin A1C, this test is a percentage, right? So if it's under 5.7%, we just said what that means. That's the amount that's coated in sugar, 5.7% or less, then that's normal. Anywhere between 5.8 and like 6.4 is what we call pre-diabetes. And then anything at 6.5 or greater is considered diabetes, and you're a diabetic at that point.
How high could that number go?
Oh gosh. Okay. Yeah. So I have some numbers because here's the important thing to know. When you look at those percentages, there's a translation between the percent, the hemoglobin A1C number and what your sugars are running. And I can't remember those off the top of my head, but I've got them right here. So let me give you an example. If your hemoglobin A1C is 7, that means your blood sugar is running on average of about 155 milligrams per deciliter, which is really high, right? If you're going to do a single blood stick to measure glucose, we would consider diabetes anything over 126. But A1Cs, I've seen A1Cs in the 12s or 13s. And if you have a hemoglobin A1C of 12, that means your average blood sugar is nearly 300. That's scary. That's life-threatening.
Yeah. That's not good.
No, not at all. And so that's why you want it low.
So I know we've talked previously, especially if you find that you're in that pre-diabetic range, not all hope is lost. Even if you're diabetic, hope isn't lost. But particularly if you're dancing right around that border, you don't have to fully cross over.
No, not at all. I mean, this is totally controllable through diet and through activity, and particularly diet, because I always ask people, what caused the high blood sugar to begin with? Well, it's eating carbohydrate. And so if you can control your carbohydrate levels and reduce those, then that blood sugar will come down. So it's really, and when people are first diagnosed, they get shocked. And a doctor usually puts them on medicine, and that's fine to start out. But I want people to understand that taking a pill does not fix a dietary disease, which is what, diabetes is.
So if someone is diagnosed and let's say it comes out of left field, they really weren't expecting to hear those words. And I could imagine that there might be some kind of shock, there. What should be one of the first questions that they ask their doctor?
Right.
Just right off the bat, should they get
Yeah.
counseling with a diabetic educator or something?
Yes, I mean, there's several things, action steps, for people that are first diagnosed, and it depends on how high it is. If it is a really high hemoglobin A1C, the doctor will probably put them on medicine right away, and that's a good course of action. But over time, and at the same time, we should be able to get this under control and reduce that hemoglobin A1C through diet in particular, but also exercise and some of the lifestyle factors, right? Losing weight is going to help improve that as well. So
how helpful or not is the internet in a case like this when you do have your A1C number? Because that's where we all go. We all go to Dr. Google.
Yeah, Dr. Google is probably not the best choice, not the first choice for people. I know it's important to try to educate yourself, but at the same time, you need to find people that know what they're doing in this area. And so the internet's definitely not the first choice. Or Facebook group, of people that have diabetes. It can get wild and crazy in some of these groups and pages. So.
Yeah, it's wonderful to know that there are support groups out there, but for the immediate, it's really get with your doctor.
Yeah, you need to get a plan together, right? It needs to be a man, and the doctor will work with you, hopefully, on reducing the medicine, getting off the medicine, and then work and helping to do that through diet.
Okay. All right. So the most important thing is that we need to know what that A1C number is at least once a year.
Yep. You can't manage what you don't measure.
Yeah. All right. JJ, anything else about A1Cs we need to know?
I think that's it. Making sure your doctor does this at your annual physical, even though your blood sugar, the single finger stick may have been normal in the past. The A1C is really the best test to use.
All right. Great information as always. Thank you so much.
Thanks, Michelle. Have a great day. Joining us now is Rebecca Denniston from Dermatology Group of Arkansas. Becca, thank you for joining us today.
Hi. Yes, thank you for having me.
I'm curious, and we've had this conversation kind of offline, but I want to talk about skin tags.
Yes.
What are they, first of all?
Yes, good question. So they are not harmful, not cancerous, little growths that usually occur in areas of friction. So areas that rub together on the body. So a lot of times you'll see them along the neckline, maybe in the groin, sometimes around the eyes if you tend to rub your eyes. Okay. But they're not harmful. They're just little tiny tags. You can kind of think of it like excess skin almost, but not harmful.
So anyone can develop these?
Yes, that's right. Anyone can get them. Really, at some point in your life, you're probably going to have at least one, but there are people who get quite a few of them, especially if you may wear necklaces or you have collars that rub along the neckline. We'll see those more often around the neck or any type of fold, sometimes under the armpits, you will get them. But yes, anybody can get them.
And they're caused because of friction. That is so interesting to me.
Yes, that's really kind of the I guess you could say the science behind it. We don't really know why exactly people get them, but we know that they occur in areas of friction.
Okay. So then how can we get rid of them? Do they fall off? Do we pluck them off? Like how do we get rid of them?
Yeah. So every now and then they will fall off on their own. The small ones, you can actually remove at home. The downside to that, though, is potentially they could bleed quite a bit. So skin tags do have a really good blood supply. And so kind of back in the day, a lot of times what providers would recommend is that you take a piece of string or maybe dental floss and kind of tie off that skin tag and cut off that blood supply, and it would come off, which you can do that at home. You can also do like little kind of scissors or, cosmetic scissors that are real small to trim them. But again, they could bleed. So larger ones, we really recommend that you come into clinic to have them taken care of. And there's a couple different ways that we can get rid of them. So we can freeze them off with liquid nitrogen. That causes them to kind of crust up and then peel off in a couple weeks. And then most commonly, we will trim them with scissors. We'll numb them up and then trim them. And then we have a few different ways we can stop bleeding if they do bleed quite a bit.
So regardless of which route you take, then do you run the risk of them coming back in a few years in the same area?
A good question. So usually the exact skin tag is not going to return once it's removed, but you can develop new skin tags in that given area. So, once you remove it, it's gone, but you could develop new ones later on.
And it's just one of those random things our body makes.
Yes, exactly. Exactly. Yes. And I do. I feel like I'm seeing more and more people come in, especially like with pregnancy. The higher hormones sometimes can cause skin tags to develop, but really anybody can get them.
I do want to draw attention to the fact that you mentioned these are not cancerous, because
Right.
I would think that could be really kind of jarring when you see that. We're trained to look at moles and watch
Right.
shapes and anything that just kind of pops up.
Yes. Yeah. So I always say that if you have a skin tag or any type of growth that is getting larger quickly, or maybe it is bleeding or becoming really irritated, we would take those off and we would actually send those to the pathologist to have it checked. Just to make sure that there's nothing abnormal, but the likelihood of a small skin tag having, precancerous or cancerous qualities is very low.
Very low. Okay. All right. Becca, anything else?
Yeah, I think the big thing is don't be afraid to come in and have them removed. If they're bothering you, it's not for necessarily cosmetic reasons. That's a reason alone to have something taken off. If it's rubbing on your clothing, your pant line, your jewelry, by all means, you should come in and have them removed.
And it's a pretty quick visit, right?
Oh, yes.
In and out.
Yes, very quick. Yeah, definitely.
Okay. Is this something insurance covers, or does it just depend?
Good question. So used to, insurance would cover them quite often, and most insurances have gotten a little bit picky on what they cover. And so some insurances do consider skin tag removal as cosmetic. And so most dermatology practices are going to have a cosmetic pricing for you if you come in. But then we are happy always to, submit them to insurance. It's just there's a chance they may not cover them. But a lot of times we'll put on there that they may be rubbing your clothing or getting irritated, bleeding, things like that. And that a lot of times will help insurance to cover them.
Good deal. Good, great advice there. Becca, thank you so much for joining us today.
Yes, thanks for having me.
And thank you for joining us. We'll see you back here next week for more AFMC TV.